Pregnancy diet is somewhat different from a normal diet. A pregnant woman must consume food that contain all the nutrients which are essential for the growing fetus, as well as for herself. At the same time, she must restrict or completely avoid foods that may cause harmful effects for the fetus. So in this video, we are going to see a list of foods that should be restricted or completely avoided during pregnancy. Number 1. High mercury fish. Mercury is a heavy metal. It is toxic to the nervous system, immune system, and kidneys. Mercury is teratogenic, which means it can cause birth defects in the growing fetus. High mercury fish you should avoid include shark, swordfish, king mackerel, tuna, and marlin. Number 2. Undercooked or raw fish. Raw fish, especially shellfish, are contaminated with pathogens such as bacteria, viruses, and protozoans. Some of them include Vibrio, Salmonella, Norovirus, and Listeria. Infection with these organisms can lead to miscarriages, premature births, and stillbirths. Therefore, pregnant women are highly advised to avoid raw fish and shellfish, including many sushi dishes. Number 3. Undercooked or raw meat. Eating undercooked or raw meat is associated with several bacterial and parasitic infections, including toxoplasmosis, salmonellosis, and listeriosis. These infections can lead to miscarriages, stillbirths, and severe neurological illnesses of the baby. Number 4. Processed meat. Processed meat contains several types of carcinogens. These carcinogens also found to be crossing the placenta during pregnancy, and research have suggested that these carcinogens can trigger childhood cancers like leukemia in certain children. In addition, they can cause low birth weight, immunosuppression, and many other defects in the child. Number 5. Raw eggs. Raw eggs can be contaminated with pathogenic bacteria, especially Salmonella. In rare cases, Salmonella infection can cause severe cramps in the abdomen, leading to premature birth or stillbirths. Therefore, always make sure to cook eggs thoroughly or use pasteurized eggs. Number 6. Organ meats. Organ meats such as animal liver, kidney, and heart contain excess amounts of vitamin A, which can lead to congenital birth defects and miscarriages. However, it is important to know that other vitamin A-rich foods like fruits do not have these adverse effects and are perfectly safe to eat. Number 7. Caffeine. Pregnant women are generally advised to limit their caffeine intake to less than 200 milligrams per day, according to the American College of Obstetricians and Gynecologists. Caffeine is absorbed rapidly and passed easily through the placenta, because the fetus does not contain the major enzyme needed to metabolize caffeine. High caffeine levels can restrict fetal growth and increase the risk of low birth weight. Number 8. Alcohol. Alcohol increases the risk of miscarriage and stillbirths. Even small amount can negatively impact the brain development of the fetus. Drinking alcohol during pregnancy can also cause fetal alcohol syndrome, which involves facial deformities, heart defects, and intellectual disability. Number 9. Unpasteurized milk, cheese, and fruit juice. These foods contain a wide range of pathogenic organisms, including Listeria, Salmonella, E. coli, and Campylobacter, which can lead to infections and related consequences as mentioned earlier. Number 10. Processed junk foods. During pregnancy, a woman needs increased amounts of many essential nutrients, including carbohydrates, proteins, healthy fats, essential vitamins such as folate and vitamin B12, choline, and iron. A healthy pregnancy diet should mainly consist of whole foods with plenty of nutrients. Processed junk foods are low in nutrients and high in calories, sugar, and unhealthy fats. Eating these foods can cause weight gain, gestational diabetes, and several other complications.